আজকে আমাদের পজিটিভ সাইড স্টুডিওতে উপস্থিত আছেন ভারতের চেন্নাইয়ের বিখ্যাত এবং সর্ব অভিজ্ঞ ডাক্তার ডক্টর গীতা হরিপ্রিয়া ম্যাডাম। দীর্ঘ 41 বছরের অভিজ্ঞতা এবং 88% সফলতার সাথে ডক্টর গীতা হরিপ্রিয়া ম্যাডাম দেশ এবং বিদেশে বিভিন্ন রোগীকে মা বাবা হতে সহযোগিতা করে এসেছে। As what is an IUI and how it is done?
Intratran Insemination is IUI. So in this procedure, we actually stimulate the patient's ovaries, we give tablets, injections, we make the eggs grow, and we do ultrasound from the 9th day onwards to follow the growth of the egg. And when the egg is released, then the specimen, the patient's sperm is prepared, and the best sperm is selected and put inside the uterus. Now, why do we do this? Because the life of an egg is only 24 hours. So we do a scan to check when the egg is being released, so that it's very precise and we do it at the right time. Now, the intrauterine insemination as such is planned because if the patient has had follicular study earlier, egg is being released, they've had intercourse at the right time, but still pregnancy did not happen, then we do an IUI. Now, sometimes there are antibodies in the mouth of the uterus which do not allow sperm to go inside the uterus. So in this situation, the sperm count may be excellent, but still pregnancies don't happen. So we prepare the husband's sperm, we actually process it, and we have several methods of preparation, and with this prepared sperm, we put it inside the uterus when the egg is released. Now the benefits are, number one, you are overcoming the antibody problem because the antibodies in the mouth of the uterus now can no longer prevent because the sperm is prepared and put inside the uterus. Number two, the sperm is prepared, so you're selecting the best sperms and putting it inside the uterus. Number three, the distance traveled by the sperm to meet the egg in the fallopian tube is only half. So the time taken is less, and therefore the success rates are better. And in statistics in our hospital has shown that the success rate of an IUI varies between 18 to 23% depending upon the patient's problem. And this is a very simple technique, and the main doubt which many patients have is, are you very sure it's my sperm? 100% it is their sperm, because we collect the container which is given to the patient to collect the sperm is labeled. The tube into which the sperm is put in for processing is also labeled, and finally the tube into which the prepared sample is put in before transferring it to the patient is also labeled, and it is checked, counter-checked and counter-checked by 3 people before you actually put in the sperm. So that is the correct way to do it, and this ensures that there is no mix-up and there is no problem with this. So this is a major patient problem in the patient's mind, and this is the answer to that question.
Okay.
Now, in an IUI itself, there are 2 types of IUI. One is the normal IUI, but suppose you want to do a higher technology in IUI, because the success rate, like I told you, varies. If you want to make the 18 into 23%, what do? You do 2 IUIs, because sometimes there are 2 or 3 eggs, and sometimes it has the IUIs have failed earlier. So we do an IUI before rupture of the egg, and we do an IUI after rupture of the egg. So that way you cover the egg with sperm both before and after. This is number 1. Number 2, you do a blood flow study, which includes the blood flow to the lining of the uterus and the blood flow to the ovary. So it is very precise. So you give the injection at the right time. When even with cooking, only if you put your ingredients the right way, you get the right result. So it's the same thing here. If you do it at the right time, when the egg is ripe, then the quality of the egg will be better. The egg will be ready to receive the sperm, and this is one thing. So your blood flow to the lining is important because this is the place which receives the baby. So it has to be a triple, we call it a triple line. It has to be more than 9 millimeters, and the blood flow should be good. And the pattern should be triple line. That's what we call it. And the next thing is the blood flow to the ovary. So the blood flow to the ovary also is measured so that you are giving the injection at the right time. And the third thing is the way we process the sperm. There is a technique called microfluidics, where you don't, normally we use multiple revolutions to prepare the sperm, but in a centrifuge. But in this, it is a membrane separation. So very easily, without any disturbance, the sperm separates itself. So you get a very good quality sperm, and this is what we do in an IVF program also. So the way you prepare the sperm And if you do it with IVF culture media, you get an even better quality of sperm, and all these help to improve the success rates in an IUI program.
Okay, well, thank you.